Hello, my name is Dr. Girish Nelivigi. I am a urologist with 20 years of post-qualification experience. The common side effects of prostate surgery are as follows. Basically, TURP and laser prostatectomy almost carry similar side effects with minor differences. But the common side effects are: 1. Stricture urethra. Stricture urethra is a narrowing of the urethra which occurs after TURP or even after laser prostatectomy. This is because when we pass an endoscope through the urethra and do the surgery may typically take about 40 minutes to 1 hour. Any indwelling endoscope in the urethra causes friction to the prostate urethra and causes some narrowing of the urethra, which could be seen a few months after surgery or even a few weeks after surgery. The second reason why stricture urethra forms is because of the use of energy source. In TURP, we use electricity, whereas in laser prostatectomy, a laser is used as an energy source. There could be some amount of dissipation or the spread of this energy which results in damage to the urethra. This causes stricture urethra. As I told you, stricture urethra is a narrowing of the urethra, and after prostatectomy, the patient comes back to the doctor telling, "Doctor, for a few days or a few weeks or even a few months, I was okay, I was passing urine well. But now for the last few days, my urine stream has become very weak. I had to use force to pass urine, and sometimes I even dribble urine, that is, you pass urine in drops." So these are the symptoms when the urologist has to suspect that a stricture of the urethra has formed. This occurs in about 7 to 10% of the patients. The second common side effect after prostate surgery, whether it is laser or TURP, is lack of ejaculation or anejaculation or maybe a retrograde ejaculation. When we operate on the prostate, the ejaculate or the semen, instead of being discharged through the urethra outside of the body, may go back into the bladder because of the incompetent bladder neck. So many patients, they come back after a prostate surgery saying, "I have no sexual problems, there is good erection, but I cannot ejaculate." So this occurs in a majority of the patients who undergo prostate surgery. Now, since prostate surgery is done in men in their 50s and 60s and 70s, this doesn't cause any issues in the form of fertility. And it doesn't have any long-term or short-term health problems also. Therefore, we assure the patient that you don't have ejaculate, but it does not affect your orgasm, it doesn't affect your intercourse, and you will not have any health problems because of this. The third, but a rare side effect of prostate surgery is incontinence or leakage of urine. This has, as I told you, has become very rare nowadays and occurs in less than 1% of the patients who undergo prostate surgery. Here, the patient, after undergoing surgery, may have leakage of urine whenever he coughs. This is called stress incontinence. So he says, "Doctor, whenever I cough, whenever I sneeze, whenever I get up from sitting or lying down posture, I experience leakage of a few drops of urine." So this occurs because of the minor injury to the sphincter or the valve which controls the passage of urine after prostate surgery. This usually resolves within a few days or weeks after surgery. The other type of leakage is when the patient has got leakage of urine even without cough. This is a more serious form of leakage of urine. This is called sphincteric incontinence. This needs exercises, some drug therapy, and many of them resolve with the passage of time. Maybe we'll have to wait for a few weeks or months. Typically, we wait for, in severe cases, 6 months to 1 year when it resolves. So these are the common side effects of prostate surgery.